Same test, but it's
general for us.
Oh, then in that case,
My name is Dr. Escobar. I'm a family-trained physician completing my fellowship in geriatrics, and I chose this topic today because 2 weeks ago I began my education in acupuncture. So no, it's one of 8 programs based out of Stanford/UCLA. And I had to travel to the city to begin my acupuncture course training, and it's mostly a self-study course. And acupuncture is such a huge, huge topic that today I just wanted to kind of focus on the science of acupuncture, if we could really call it a science, because it's really a different approach to life and illness and so forth. And so whatever science has been done to validate it is just what I want to talk about initially, and then maybe future topics we could go into acupuncture and other clinical settings. So objectives for today, just give a brief, very brief history or insight into Eastern philosophy. I actually took a class in this in college. The general theory of acupuncture. We'll look at some studies of acupuncture points and channels. Look at some other studies of acupuncture effect on the body and brain, and then talk a little bit about acupuncture analgesia, which is really what a lot of people seek acupuncture for, is for pain relief and so forth. So what is the appeal of acupuncture? Well, medical benefits. I'm not going to talk about this specifically, but acupuncture has been seen to help significantly with reducing pain, and with chemotherapy-induced nausea, just to name a couple of things that it's been used for. It is a holistic approach. It's seeing the patient as the whole body, mind, body, spirit, energy, force, so forth. It's not just they have this one disease and this one symptom and that's what we're going to treat. It's looking at how everything flows in their body. The cost. Relative to expensive radiology testing, lab testing, hospital stays, so forth, it is a lot less expensive. If you're paying just for the actual needle, which could cost $10 for several treatments, so forth, and the space and time of the physician or whoever's doing the acupuncture treatment, it is a lot less. Side effects. Really not many side effects. There are some problems that can occur. There could be some local dermatitis or irritation of the skin from the needle. There has been a few problems with, very rare, but like a pneumothorax if a needle is placed too close to the lung area, so forth. But those have been very rare that have occurred. So most of the time, the side effect is just either they have a little bit of euphoria. Sometimes you get a little nauseous. They get a little weak, so they'll have to. They should be laying down for their first treatment, just because you don't know how the patient will react. But that's really it. And then after several treatments, those side effects usually go away. So So based on all this, therefore, there's possibly a great benefit for our geriatric patients. Looking at if it could help any with pain, nausea, low cost, few side effects. I mean, that's what we're looking at for all of our patients, and especially geriatric, as they're facing more and more comorbidities, a lot of pain issues, and just everything that they're taking, trying to reduce polypharmacy, which is one of the appeals for me. In being a geriatric doctor, I want to reduce polypharmacy as much as possible, and if I can take away any sort of pain medicine or nausea medicine or whatever they're taking, if I can reduce that by 1 with acupuncture, then I feel it's a success. So the uncertainties of modern medicine. And what I mean by this is, what are these diseases that we still don't have figured out? One of them, migraines. Yes, we have treatment for it, but there's still so much studies into what exactly is done for it, how to, they're so various among people and so forth. Dementia is another one that Dr. Angulo had talked about earlier, that we still don't understand. There's such a wide variety of dementia. Parkinson's disease, another big one. This is the big fibromyalgia / chronic fatigue / irritable bowel syndrome that I know I was frustrated in my training and when I would get patients like that, because I didn't have something I could pinpoint as this is what's wrong with you and this is what I can fix, or this is what we can do to help you. It was just a lot of theories, a lot of, patients were frustrated, I was frustrated. It was just, very, at the end, we just still didn't have an answer, and yet we still don't. Reflex sympathetic dystrophy, another one, patient just in chronic pain, really unsure of the underlying mechanisms of this. So, does acupuncture cure all these? No. It is not claiming to cure all of these uncertainties of medicine. It's just offering a different approach to what exactly is going on in the patient, and in that different approach, a lot of these symptoms or issues that the patient is having can be reduced. What the course I talked about earlier is a medical acupuncture course. It's acupuncture for licensed physicians. The one I took is through the Helms Medical Institute. It's one of 8 programs here in the United States that will train physicians, licensed MDs or DOs, or pretty much MDs, DOs, or dentists, some programs. There was a podiatrist that was in the program, and he technically could take the class, but he could not practice it because in the state he was practicing in, he still had to go through the acupuncture school. So really, it's for physicians. In the state of Texas, as Dr. Angulo said, there's no extra certification required for physicians to practice. If you have a license to practice in Texas, you can hang up your shingles anywhere and say, I can do acupuncture. And really, that's it. So all of us could do that who have a license here. There are 15 states, one of them being New York, that requires either 200 to 300 hours of CME to be accredited to practice acupuncture.
So specific acupuncture.
Exactly. Exactly. And it could be taking the Helms Medical Institute. You can get up to 300 hours just doing the home program that I'm doing, or you can just go to different conferences and get your CME that way. It doesn't have to be an official program, and so forth. There is a board certification, the American Board of Medical Acupuncture. There is an exam you take. You have to complete at least 220 hours of CME in acupuncture and have 2 years experience. And you can then be board certified for this. So now let's talk about briefly Eastern philosophy, acupuncture, and I say put all reason aside. I mean, E = mc squared. This is the definitive physics, science, everything we've been taught in our Western world about this equals this, and this is how you think about it. I can see this, I can put a physical hand on it, or concrete. But just for a while, let's put all those kind of reasons aside. And I had to tell myself this too when I was going through the course a couple weeks ago, because I was like, this doesn't make sense. I don't see that. I don't understand that. But if you just kind of step back for a while and try and approach this from a different angle, then you can get more of an appreciation. And then later on, we'll put back in reason, and we'll talk about what the actual science of acupuncture is. Eastern philosophy. Qi. This is the life force. If y'all have ever studied Eastern philosophy, any of those sorts of things, it's circulating through us. It's protecting us. It's nourishing. It's not really translated well from what I've been told, but it's something that's in all living beings. What I try to think of it is that in Star Wars, when Yoda would talk about the Force, you know, with Luke Skywalker, it's the Force in him that gives him the whatever he needs to fight against Darth Vader and all the other people that are kind of against him. So if you want to think about it that way, it's that sort of approach. It's in everybody. It's in everything, and we have it flowing through us, hopefully in a more balanced and harmonious way. If you've ever heard of feng shui, that's similar. It's kind of a step off from qi. Feng shui is about placement and arrangement of your space, of your house, of your workstation, of your car, of everything, so that you're balancing out the qi, you're balancing out the 5 elements, which I'm not really going to go into, and you're balancing out the yin and yang, which I'll talk about a little later. So qi is just not the body. Qi is everything around you and everything that you interact with. Again, put all reason aside. This is just a different philosophy approach. The other parts that is looked at besides qi, this energy, is that blood. Yes, there is blood, and it's seen as providing nutrition for the body, which we all understand. Moving blood helps body movement. It aids the mind and mental activities. If you have good blood moving through your mind, you think better. You're more clear. The body fluids also, and those being the intestinal fluid, gastric fluid, tears, so forth, are there also to nourish and protect the body. So all of this works together. The qi works with the blood, works with body fluids. Everything's kind of in a harmonious balance, and if anything gets stuck, then there's issues. Another part of the Eastern philosophy is the yin-yang, and you're probably all very familiar with the symbol here, the yin and then the yang. The yin is the darker portion of the circle. It's about the inward, the cold. It's a balance. The yang is the brighter, the energetic movement, stimulation. Yin is damp. Yang is dry. Yin is cold. Yang is heat. But really, you can't have one without the other, because you can't say something is cold unless you know something that's warmer than it, and then therefore it has a balance. And that's where the symbolism comes from, that in every part of yin there's a yang, in every part of yang there's a yin, and there's a balance that has to be, reached for things to continue in a harmonious way. The history of acupuncture. First recordings of acupuncture are actually dated back to 2nd century BC, and it was just explaining kind of the natural phenomenon of all these things we've been talking about qi, about how the body moves. But these first recordings were very eloquently stated. I mean, they must have already been formulated over hundreds of years prior to this before actually being written down, because the explaining it was very eloquent and very sophisticated. We then moved into modern acupuncture, written in the 282 AD, where it actually talks about specific points, what acupuncture is, how you can kind of grasp onto this qi and try to manipulate it, so to speak. When it finally hit the Western world in the 17th century, when Jesuit missionaries went to China, and that's when we had our first exposure. That's when kind of East meets West sort of stuff. Just things they had never been used to, things new philosophy of being, and then of course the Jesuits brought some of this information back to the Western world. Really here for the United States, the big exposure came, and when I say Western world, I meant Europe. So for the United States, the big exposure was in 1972. Nixon famously went to go visit China. There was a reporter that went along with him, had suffered acute appendicitis and had to go for emergency surgery. And during his post-op course, he had acupuncture done for pain, and he was completely floored by this. He couldn't believe that he wasn't receiving the standard morphine or whatever pain medications he would receive here in the United States. All they were doing was putting needles in him, and he was just taken back. And so one of his reports from this, he wrote about it, and people were just completely, you know, opened up to this whole approach. Okay. So acupuncture energy, what exactly is that? So the energy flow, the chi that I had talked about, again, is going through the body in an organized fashion or balanced flow. Again, the yin-yang. The chi is moving through a yin-yang form. And the way it's explained to me is that the yin part of the body is the front, the yang is the back. And that's the way that energy flows. It starts at your feet, it comes up, it goes around your body to the back, and then it goes back down. And it continues in this sort of flowing manner, balancing out the front and the back, balancing out your energy with the earth, your energy with heaven, so forth. And so we're trying to keep that energy flowing as well as possible. So if the flow of chi becomes blocked, stagnated, weakened, it can result in physical, mental, or emotional ill health. So anywhere along the front, the body, anywhere around you, if there's, again, like feng shui, if you've ever heard of it, if there's something blocking the energy to your front door, it's not going to create a harmonious environment in your house. So you have to move the energy out or block it so that the energy can be moved. The same thing is here in the body. If there's a block and if it's not strengthened enough, you do things to help that chi flow well again. Chi concentrates in certain areas of the skin's surface, very small points known as acupuncture points. And just so you know, my little annotation here, AP, is, you're going to see it later on, and that's just acupuncture points. It's just abbreviated. So, energy is accessible through more than 350 separate acupuncture points throughout the whole body, including the ear, which is, you know, kind of a subset off of acupuncture, is the ear acupuncture. So, the energy flow that we talked about, they travel in what's called meridians. They are channel systems linked by acupuncture points along the body, and they carry and distribute the chi, the blood, the body fluids. These are not blood vessels. They have no anatomical channel structure. You can't see it on an MRI, you know, so to speak, specifically, but you can see the effects of it, and I'll talk about that later. There's 12 principal meridians. They congregate. The way it was explained to me in my training is that these 12 principal meridians that flow throughout the body congregate to form 3 bilateral symmetrical pairs of subcircuits. So there's 3 main subcircuits that the meridians are composed of, and you'll have one subcircuit that goes through like the front and back part of your body, another that'll go like on the side of the body, and the one that just be located mostly on the back with some interior parts as well. So this briefly is a rough diagram of the meridian subcircuits. You can see here how it will flow up around to the top of the body and come down. And it's not designated on which are paired with which, but that's what we spend a lot of my introductory time is talking about these. The principal meridians, again, what I'm talking about, the most important and largest, straightest transport channels. This is like, was referred to me as the highways, like how you can get direct major energy channels and have direct stimulation of the chi. Each subcircuit is a couplet of yin and yang. Again, yin front, yang bottom. Yin is also lower part of the body, yang is the upper part of the body. The subcircuits are related to each other by this yin and yang transport system. Also associated with the meridians are organs, and the three base meridians also have 4 organs associated with them, and they can be influenced along these meridians. Now, if you're wondering, okay, for example, one of the major organs would be the heart, and one of the points for the heart would be along the arm. And you're like, okay, well that makes sense. You know, the arm is located near the heart, and if I wanted to have some sort of stimulation of that, that would make sense that it would be, you know, thinking dermatomal or other sorts of things, that would make sense. However, one of the other meridians would be the kidney organs, which is up here, but the acupuncture points for that are on the leg, and that kind of throws people off a little bit. You're like, wait a second, that's lower extremity and the kidneys are a little higher. How can you be influencing? Again, this is all about flow, and the flow is continuous, and as long as it eventually gets there, it is associated with it. So this, a lot of times during my training, I just had to step back and say, okay, this is not things I've been used to and taught for 30 years of my life, but it's a new approach. There's other subsystems besides the principal meridians that I talked about. There's the tendinomuscular, and these are kind of the coverings over the body. This actually will be used a lot in pain issues, stimulating direct acupuncture points that will have direct pain relief for patients. There's shumu, which are other points along the body which have direct access to organs, another important part of the acupuncture. Distinct meridian subsystem, another way to access organs directly, and then curious is kind of an energy hold of acupuncture points. If you stimulate them, they actually give extra energy to the patient. So my first exposure to acupuncture was in medical school, and I went to an acupuncture school in Houston for lay people. There are acupuncture schools for lay people where they have to go for 3 or 4 years and so forth. And she goes, well, do you have any pain? I was like, no, I don't have any pain. And she was like, oh, well, I don't know what to treat you with. She just wanted to give me an experience. I go, well, I'm running a 10K tomorrow. And she goes, okay, I'll activate an energy point on you that'll give you extra energy. And she put an acupuncture here in the middle, which I forget what it's called. I should have. But she's like, opening up this energy point will give you hopefully extra energy tomorrow while you run your 10K. So I ran it pretty well, so I don't know if that was directly from it or just, good night's rest and carbohydrate load before, but either way. So an acupuncture treatment, again, acupuncture points, we want to stimulate those points to actually get control of that qi energy. The needles can be left in for 15 to 45 minutes, it's variable, and then you can use electrical stimulation, which is actually an actual way to kind of waken up that point for the patient. And again, the goal is balance. If you have excess, if you have overactivity, your acupuncture point wants to calm it down. If you have deficiency or just not enough qi running through you, you'll kind of stimulate it to actually get more energy in that. And that way it can start flowing better. So now let's go to reasoning this out. This is a lot of outside thinking that a lot of us may not be used to. Of course, some of us may be if we've ever been exposed. But let's look at some of the science of these acupuncture and some studies that have looked specifically at them. Now, just as a prefront to this, a lot of these studies were done maybe in the 60s, 70s. A lot were done in Europe, in China. And I did not specifically go through the study and critically evaluate on their methods, so forth. I kind of took it because it's difficult to put a science to this. It's a different approach to life and energy and flow and treatments and so forth. But they do have a lot of validity to them, and I think it's just worth discussing. So a brief kind of statement is that electrical conduction at acupuncture points is different from their immediate environment, and that the excitation of those provoke physiological responses. So these points, these 350 points that have been identified by Chinese philosophers for thousands of years, people have looked at them and actually found that, yeah, there's actually something different about this point on the body. The electrical conduction is different from surrounding tissue. Other studies are saying that, yes, the electrical resistance between two acupuncture points, so along a meridian, so let's say we're looking at the heart meridian again, and we look at one point versus another, that electrical resistance is actually lower and is symmetrical on both sides of the body as compared to other random points along a surface body, so forth. So this is a specific study. They looked at skin conductance on acupuncture points of the pericardium, which is similar to the heart meridian, and the large intestine meridian. So these are located on the arm. And they looked at conductance there versus just regular points along the body. So 17 subjects, and for each acupuncture point, they found an anatomically similar location, 1 centimeter squared, was chosen. Again, on the arm, but just different, not found to be associated with a specific acupuncture point. Neither the subject nor the operator was informed of which area contained the acupuncture point. So the person who was actually putting the needles in was just told, you put that there, you put that there. They didn't know what was real and what was not. It was like if I told Elena, just put a needle there, gently, and I teach her how to do it appropriately, she wouldn't know what was real and what wasn't. And they found that acupuncture points had increased conductance at each time. Another study, they looked again at electrical impedance, again looking at the electric resistance, what exactly is going on at these acupuncture points. Again, the pericardium and the spleen meridians are actually on the legs up into the chest area. They looked at 23 human subjects. Along the pericardium location, they found that lower impedance, was lower at these acupuncture points compared to just regular sham points. So greater electrical conductance, less electrical impedance, less problems flowing the energy through than the non-meridian parallel control segment. So there is something that these points on your body that are just anatomically different and shown by these stimulation of electricity. There's something different, and it's pretty much parallel on each side of the body and over many people. I mean, 23 is not a huge study, but 23 in the 17 in the previous one, it's pretty consistent. So what exactly is an acupuncture point? Well, the theory is that the center is a lymphatic trunk, so some lymph node that, again, takes away body fluids, one of the major fluids in Eastern philosophy, coupled to an arterial and a satellite vein. So our major circulatory system is composed mainly in these acupuncture points. So the lymph arterial vein creates a passage between the skin and the deeper tissue. So if you think of the point is here, and then it's like a little outing, if you stimulate it, and then that's allowed to kind of flow throughout the tissue. Or the fascia. The fascia is really where they think a lot of the energy flow is allowed to move. And remember, fascia from gross anatomy, it's everywhere. You can't get away from it. Other observations found that most acupuncture points consist of penetrations of these nerve vessels. There's also nerve endings that are associated with this lymph arterial vein passages, and that come up through the superficial fascia. Again, the fascia, there's like little openings, and these little points are there. You stimulate them, and then the theory is that the movement or the stimulation can pass through them. Another study that I looked at, evaluation of blood flow at an acupuncture point. So if you stimulate that point, again, we're saying that it can penetrate through the body. It has an effect. Can we see that, with blood flow? Can we see that by nitrous oxide that is formed there? So they stimulated different points. That's liver 4, pericardium 6, per 8, and 6, heart 5. So these are all points along the arm. And they looked at the nitrous oxide formed by taking actual blood samples from it. And then they looked at versus sham acupuncture subjects that were blindfolded. So the person was stimulated at the appropriate acupuncture point and then had a blunt adherent instrument off of a sham point not associated with it again. A week after the first acupuncture treatment, whether real or sham, the subjects underwent the opposite treatment. Before the acupuncture, 5 and 60 minutes afterwards, subcutaneous circulation of the palm on the side of the treated arm was investigated using a laser tissue blood flow meter. And then the measurement of nitrous oxide was then determined. So if the theory of the acupuncture is that if the energy is flowing to the arm and then back from the arm, and if you stimulate a point on it, and again the chi, the blood flow can move easier, then the blood flow down the arm would move easier, and that's what they were looking at. Just as a side, the non-invasive sham acupuncture subject considered that the treatment was less effective. They felt that their hand wasn't more warm. They didn't feel any real benefit from it. Before acupuncture, palmar blood flow in the real and the sham did not differ. So they kind of, prior to, they both had the same. But at 5 and 60 minutes after acupuncture, both palmar blood flow and plasma concentrations of nitrate plus nitrite was significantly increased compared to prior to and compared to the sham group. So there really is some sort of movement, objective finding that you can see just by stimulating one point versus stimulating a non-acupuncture point in a similar fashion. So, again, sensation of these acupuncture points. If you were to ever have an acupuncture done to you, what would happen is that a needle would be placed at the appropriate site, and either by pressing it deeper or turning it, the acupuncturist and the patient kind of feel this moment where the energy is grabbed, or where something changes, and that sensation of that has been found on fluoroscopical changes in the organs. So if we're saying that this is the heart meridian and they stimulate that acupuncture point to where I feel something, then it actually occurs in the brain as well, and they can see this kind of change in your body. The sensation of the movement that they stimulate on the heart that actually gets to the heart travels at a rate of 1 to 10 centimeters per second. And it does not follow somatosensory distribution. So like I said earlier, the kidneys, those meridians are located on the lower extremity. So even stimulating those would have an effect on the kidney, but again, not really associated in our ideas of somatosensory distribution and what we're taught. So the effects of acupuncture on the body brain. We talked a little bit about this with the palmar blood flow. Acupuncture stimulation modulates activity in the spinal cord and is associated with treatment of sensory-motor deficits. So again, it affects the blood flow, and then the nerve stimulation actually can be seen in the spinal cord as well. Stimulation of acupuncture points has a specific effect on cortical neural activity, absent with sham. And we'll talk about this a little later, that again, the stimulation can be seen in the brain. Acupuncture appears to have distinct effects on cortical activity, again, by MRI and PET. So one of those studies, 15 healthy right-handed subjects aged 22 to 59, and we looked at the effect of acupuncture on the brain by functional MRI. So a stainless, non-magnetic needle, and I made sure, because otherwise I was thinking MRI and have a magnet, there's going to be a lot of issues there, but they used a non-magnetic needle. Stimulated 3 points in random order. They had a sham point on the foot, a specific acupuncture point, liver 3, and one on gallbladder 40, which gallbladder 40 is also on the lower extremity as well, and liver is on the upper extremity. So, random points. They didn't, the test subject did not know what was real, what was not. So a needle was inserted, rotated for 10 scans, and then left in place, and then followed up. So they did initial scans. They stimulated either a sham or a real acupuncture, stimulated, did some scans of that, and then followed up while they were rotating. So they activated, they put it in, and then they kind of twirled it, as I said, to actually get that catch-on feeling for them. So the left liver 3 and the left gallbladder 40 stimulation of those acupuncture points actually elicited bilateral activation in the orbital part of the inferior frontal gyrus, posterior part of the inferior temporal gyrus, insular and secondary somatosensory cortex, and the right basilar ganglia. So a lot of different parts in the brain were stimulated by just one side of acupuncture stimulation with rotation of the needle. So they put it in and then they stimulated just by turning it until they reached that point of kind of grabbing on. There was stronger activation in the area. So the MRI saw that there was some light up, so to speak, and then when it was stimulated even further, it lit up even more. The sham acupuncture did show that there were some, light up points in the functional MRI, secondary somatosensory cortex, so forth. But their rotation did not produce any further change. So even the body recognized that something's there, but stimulating it, so to speak, the body did not really respond to it the same way it was seen on the real acupuncture points. So again, it's noticing something, but sham versus real, there is a difference. And acupuncture analgesia. Connection between activities of the endogenous opioid peptide system and analgesic events with electrical AP stimulation. So a lot of acupuncture, as I said previously, is used for pain, to help with pain. And there is a theory that, again, these acupuncture points do have or can activate the opioid system in the body and kind of release that natural opioids that we use to kind of comfort ourselves or whatever's needed for any pain stimulation. Acupuncture needles stimulate small myelinated alpha-delta afferent nerve fibers and small myelinated group 2 and 3 nerve fibers and muscles, again, all associated with pain. 20 subjects aged 24 to 56, and we looked at the effect of the motor neuron activity via the tibial nerve stimulation. So let me show you. So if you see here, this is the gastrocnemius and the tibial nerve running along it. They set up electrodes to look at EMG functionals of this along the muscle, and therefore looking at the activity of the nerve and the muscle together. So, acupuncture point gallbladder 34 and spleen 9, which are located on the lower extremity, were needled and stimulated manually, each done for 5 and 20 minutes, 2 weeks apart. So they had one test and then came back 2 weeks later. And then the alpha motor neuron stimulation done by the EMG along the tibial nerve was measured prior to, immediately afterwards, 15 and 30 minutes after the stimulation was done. No significant change was found in the motor neuron stimulation in the short duration of acupuncture. So 5 minutes afterward, nothing major seen. But there was a significant reduction in the excitability of the neuron 30 minutes after the acupuncture, and that was still apparent 30 minutes after the intervention was even ceased. So when they stimulated that point, they were able to see it. It had to be stimulated for a good amount of time. And like I said earlier, acupuncture is usually left in for 15-45 minutes. So you have to leave it in for a little while to really grab hold of the chi and make a difference. But even then, after they took it out, this change was still seen for 30 more minutes. Looking at the brain, the anterior cingulate cortex is involved in number of pain responses, both in tonic, persistent, and acute pain, in pain anticipatory mechanisms, and in pain-related multiple cognitive procedures. So different parts of the brain recognize pain issues. The insular region has also been described as focal node for pain intensity and coding the intensity. Cerebellum has also been proposed, and these are just kind of background information for the next study that I looked at. So it's also been seen in the circuitry for the senses of what pain is and how the body relates to it. So 13 young male healthy subjects, 21 to 32, were tested. Again, this is a functional MRI. They were looked at the rest state. They had a placebo or sham false acupuncture, or they had true acupuncture. The true acupuncture was at points stomach 36 and lung 5, which are located in the upper extremity, and were needled. The false acupunctures were inserted superficially at different points, 1 centimeter lateral to each true acupuncture point. So, and again, a non-real point, and immediately extracted. They rested for 25 minutes, and a PET scan was done prior to and after. So you can see here some of these little lighted areas, and this is in the true acupuncture parts of the body. So during the application of the true acupuncture, increased cerebral blood flow in the the left anterior cingulate cortex insulated bilaterally and the cerebellum bilaterally, and the right superior and medial frontal gyri. So things lit up. During the false acupuncture, there was increased cerebral blood flow in different parts of the body. And there were actually some common areas between the true and the false that were stimulated as well. But these were thought just to be from just movement in the programming, just the processing of the body, and so forth, just like a regular response to the stimulation and so forth. They did see that the areas activated by the true acupuncture were areas that are activated in acute and chronic pain states. So that anteriors, so if we look back here, the anterior cingulate cortex, the cerebellum bilaterally, those specific points were seen more significantly in the true acupuncture versus the sham acupuncture, or the false ones. Overall theory is manipulation of needles and electrical stimulation, again, waking up that chi, provokes the diffuse noxious inhibitory control system, or a DNIC. And that's just a theory that you inhibit pain by irritating something else, which makes sense. If your elbow's hurting, then if you make your shoulder hurt, then it's going to, counter it off, and then your elbow doesn't hurt as much. So that's kind of the theory that can be proposed also with acupuncture. If you're causing discomfort in one part, it's just going to balance out the whole discomfort in the whole part of the body. The system inhibits pain through a common spinal interneural pull and nociceptive reflex. So again, if your elbow hurts and you stimulate your shoulder in the same kind of spinal pathway, then it'll balance it out. And the site and frequency of stimulation are less important than intensity. So it's really about how much intense you can make that other point to balance out the initial pain issue. And this effective is not just limited to acupuncture, so we're trying to balance out what science is having to say and what we theorize that acupuncture is actually doing to the body and why it's able to have so much effect in analgesia. So future topics. Again, I didn't go into clinical studies of acupuncture for specific maladies. What I alluded to earlier was the chemo-induced nausea for pain. They've looked at a lot of back pain, especially knee pain, a lot of the problems that a lot of my geriatric patients have. That could be maybe a future talk. Just to give you tips on quick acupuncture relief points. One of the big ones I'm sure all y'all heard of is between the hypothenar and the first phalange here. If you have nausea, if you have a headache, just kind of stimulating that can help a lot with your symptoms. And then extending acupuncture for geriatric patients. Again, the pain symptoms and then the energy stimulation. A lot of our geriatric patients just have this kind of fatigue, and you see them and you just see they don't have that same vibrant life that other patients have. And if there's acupuncture theorizes that it can kind of wake up that chi in them and keep it and moving better. So, may the force be with you. That's it.
Oh, okay. Okay. Just some of the basic understanding of the elemental concepts there. Initially, you had said that you'll use the acupuncture then for sluggish chi and low chi, which I can understand the sluggish chi, but is it too positivistic of me to ask if it's low chi? What is the source of the chi? Are you bringing in more, or I don't understand that part.
Well, from my understanding is that the chi is there, it's just blocked in one area. So if it's low at one point because it's blocked down here, if you release that block, then it can move up, and then it can be stimulated, farther up the meridian or farther up the channel that you're working in.
So do we each have a finite amount of chi? I don't know.
I don't.
Well,
yeah.
Can you? Is it internal? Is there an external?
There's kind of.
Or
there's kind of. a part of your chi comes from your genetics, what you're born with, and then the other part of your chi is nourished by your nutrition. So everything that you take in. So if you have, if you want to increase your chi, and then there's other things like herbs and nutrition and other stuff that can help stimulate it better, but it's not necessarily, I don't know if you can get to a maximum point or you can just keep going up in chi for forever to have like Superman powers or something, I don't know. But that is the theory.
Yeah.
And then the other thing is that there's overstimulation of chi at one point, again, that blocked area, then you can have overexpression. So one of those things would be like acne. So things are just, the sebaceous glands are just too active, they're going crazy, and so you want to block that, you want to release it, you want to make it not as active, and that way you can calm down and you won't have a lot of those symptoms.
Or you can find any day some G.
Yeah,
Right.
you can buy anything.
Right.
I recently read Dr. Fang's articles at MRI, because it turns out that those regions of interest that are activated by acupuncture aren't just spots up there. They're actually the brain's autonomic control network. So the insula has a somatotopic map of all the organs in your body, and receives inputs up the vagus nerve from each. So there's a cardiac region, a gastric region, a whatever. So, and then the insula feeds its output forward to the posterior orbitofrontal, inferior orbitofrontal. So basically what's happening is you're activating an autonomic control system. And presumably then it could affect things and go back down the other way. And once you're into autonomic function, that controls everything. Heart rate, gastric mobility, blood pressure, even the immune system, even bone density and regeneration are under autonomic control. So there could be something to it that would have nothing to do with chi. But it would have a lot to do with the brain, and therefore the patient's understanding and perception of what's going on would feed into it. So I wonder if people have done studies. Does acupuncture work as well if you've never heard of acupuncture, you have no idea what it is? Does acupuncture work in people whose vagus nerves have been cut, like after cardiac transplant? You might find that acupuncture doesn't work. Or if chi, energy, flow, all of that you don't have to be a participant. You don't have to be a conscious participant in it. So does acupuncture work if you're unconscious?
That's true.
So, I mean, there are a lot of ways to get at it without just accepting whole cloth that, it has anything to do with flow or lymphatics or stuff for which there really isn't any evidence. What you got evidence of is that stimulating a piece of the skin activates a autonomic control system in the brain. And I think that's a really approachable way because, we can do fMRI here. There are all sorts of cool things you can do. We're showing that this same autonomic control system mediates between depressive symptoms and sudden death. So in geriatric patients, the risk of mortality in depression is twice what it is in young adults. And it's specifically the insula that's mediating that. And so what's not known is whether antidepressant drugs make that better or not. Depression causes changes in heart rate variability. Those changes are associated with insular blood flow. And it's not obvious that antidepressants make it better. From what I can find in the literature, some of them make it worse, and some of them are indifferent. So you can make your mood better, but that doesn't mean your heart rate variability will get better. Ironically, there's more evidence that acupuncture and things you would think of as alternative, therapeutic massage and yoga and stuff like that, make heart rate variability better in depression, and the evidence is stronger, such as it is for those, than it is for antidepressant drugs. So, and I think what they all have in common, that psychotherapy doesn't improve heart rate variability in depression, because psychotherapy involves activating cognitive resources that have nothing to do with autonomic control, but somatic stimulation does. So massage makes heart rate variability better. But talking to somebody about their problems and perceptions in depressed state doesn't really improve autonomic function, and neither does just taking a drug. So, so I've thought, if antidepressants kill you, And you know, there actually is a recent study in elderly men that showed that taking antidepressants is a risk factor for death after depression. So maybe drugs aren't nearly as benign as we think they are, especially if you look at large numbers of people. So there's a role for non-traditional treatments for these things, maybe as a way to reduce mortality in depression. But I'm not really convinced as things, you know, it has to do with the traditional Chinese explanation for what's going on. And so I really think you just got to look at it as an empirical phenomenon. It, you know, stimulating the skin does change the brain, and the brain controls everything. So if you got a tool that can do that, it would be really cool just to see how far you can go. And I think it would be really cool to look at acupuncture as a way to moderate heart rate variability changes in geriatric depression. That would be really interesting.
Thank you.
Thank you.
So make sure you complete your evaluation for me.
Ah